I told her it's pleomorphic adenoma on the palate. Academics was, yes, the craze. I joined OMR thinking that I will get a government job and I will be teaching students around and I'll be earning a good amount. Welcome to Unidontia Dental Podcast. Our today's guest is Dr. Vijay Asrani, who is exclusively practicing oral medicine and radiology and the founder of Heal Me Orofacial Pain and TMJ Disorder Clinic. In today's episode, we will be learning about what are the scopes of oral medicine and radiology, what are the future perspective of it, and how to treat a patient, how to diagnose a patient, and a lot more clinical cases that we discuss with Dr. Vijay Asrani. Hello, Vijay sir. Good morning, and thank you for coming to our podcast. First of all, I would like to tell you that just because of you that I have cleared my final year exams and clear my medicine topics. Otherwise, like whenever I reading for the OMR, I'm just reading the book and nothing is coming in my mind. But you made it so easier for me. So I'm following you since my UG days, and now I've seen you like Heal Me Clinic and expert practice on OMR. So let's begin our podcast. And before that, can you tell me something about yourself and Hilmi Orofacial Pain and TMD Clinic? First of all, thank you, Rohan, for having me here. Yes. Thank you for giving me the credit, but actually, I don't deserve it. It's basically you who have gone through all those topics and got depth into the subject of oral medicine. A teacher always tries that a student understands the way he wants to teach and probably the best he can get out of it. Talking about me, yes, myself, I am Dr. Vijay K. Asrani, specifically PDS, graduated from Government Dental College and Hospital, both my UG and PG, and I'm a PhD fellow in orofacial pain and TMD. I'm just about the submission at the submission stage of my PhD. Considering I loved OMR, see, we are like of a kind of a persons who are willing to get into medicine field and MBBS tech, but there is always something which we feel that can enlighten us. Yes, orofacial pain and DMD is a thing which can be said that it enlightened me. Now, considering enlightenment, uh, I was not sure that my enlightenment would lead to this, which I'm definitely proud of, and I hope everyone is feeling good about it because Heal Me is specifically about every person. It's about you, it's about me. See, everybody is suffering from something or another. Okay. So when you are discussing about the title of what should be the name cap, my MBA friend, he's also a dentist, Kashish, we came with something that heal should be the primary word. Okay, because everything lies on healing. And healing has many definitions. Okay. So and later on he was like, "Okay, why you want to keep me? I wanted that it should be me. And why you?" So I told him that there is a famous quote or there is a famous saying that a doctor doesn't cure patient or a doctor doesn't heal patient. It's the patient who himself heal him, yeah? Heal him or her. So we just provide an environment. So that was the thing which was rooted in me since long, and I tried my best to provide the finest environment to a patient so that he can heal himself and we be a supportive role again. Because again, doctors are the one who try to cure patients, and that's definitely the thing. We try to remove the etiological aspects. We focus on many aspects. And etiology is the prime thing where I constantly work since long. I'm focused on etiology. I don't focus on the diagnosis now. Initially, when we were in the post-graduation phase, everybody was curious about the diagnosis thing. But since then, I was curious about the etiology. Ho kyun raha hai? What is the prime cause? If I'm not knowing the etiology, I can't care. So considering the factor, I see a lot of patients with headache nowadays. So everybody is like, most of the time it's migraine. सबको ऐसा है कि headaches is just migraine. But it's not. Migraine is most of the time misdiagnosed. Okay? So there are certain trigger factors. We see that stress is a factor. Now coming stress, सबको है. Everybody is stressful. But why? Why? That's the important. So that why, the curiosity of why lead into focusing on Heal Me Orofacial Pain and PMD. And that's what it is. I definitely love to thank all of those who have supported me, especially you also in your journey and all those things, and motivated me to create this venture. Yes, I'm proud that it's one of its kind in Gujarat. It's probably first center in Gujarat exclusively dealing with headache and TMJ disorders. And I feel good about it because recently I went to US also, so everybody was like, yes, you're doing something good in your field, so you are here. Definitely, sir. I have seen your post on Instagram, like you are
doing lectures in US and all. And definitely, when I visited this clinic first, like I'm feeling very calm and like it's like a peace in this place,
Thank you
and
so
a
much.
very aesthetic one.
Thank you
So, like, can you tell me something about what is orofacial pain and TMD disorders for a layman person who is looking for the pain and something, and for a dental professional who can help you treat something?
See, for a layman person, it's like, firstly, not people are aware of these things. Okay, what is orofacial pain and TMJ disorders and PMD? Specifically, this field is kind of a broader aspect, but has a specialized aspect. जैसे फॉर एग्जांपल लेमन को बोलने जाए तो किसी को हेडेक है, सो हेडेक व्हाट वी डू, हम हमारे जनरल एमबीबीएस फिजिशियंस को दिखाते हैं. ओके, बट फॉर मी इज लाइक इफ यू आर हैविंग headache since long and you're not able to cure it or you're not getting a diagnosis, then definitely you should come to me. Okay. Headaches are of multiple varieties, specific TMJ disorders. Now just giving you an example of certain things. जैसे आपको अगर joint में pain है और you have ear pain, now what do you think most of the time ear pain is? It is paining here. Okay. Now the close association, मतलब TM joint ear के इतना पास में है, if it's paining in the TMJ, a normal person feels it's paining in the ear. Okay. So when the ENT person sees, okay, they say the ear is clean. So suppose a person should understand कि अगर कान में कुछ नहीं है, definitely there is a thing which is joint which is affected. So you should see me or you should see any TMD specialist. Okay. What the problem is happening around कि layman को break करिए कि they are getting multiple references. Okay. अब suppose dentist के पास गया. See, dentistry is a field in which every person feels that they can do everything and there is no laws. And I really feel that's the best thing to do. But TMJ and OFB is not that thing. The reason being, if you are trying to explore, then that's a different thing. But if you are trying to just try things out, okay, let's give this patient this medicine, let's give the patient this medicine, let's give the patient this medicine, then that's the problem for the patient and for you. What's the problem? It becomes chronic. पेशेंट आपके पास पहली बार आया, आपने उसको मसल रिलैक्सेशन दिया, टीएमजे पेन है, मस्कुलर पेन है, पेशेंट फिर से 7 दिन बाद आया, पेन ठीक हो गया, यू आर हैप्पी, यस आई क्योर्ड द पेन, यस यस यस, पेशेंट को ठीक नहीं हुआ, कुछ नहीं हो जाएगा. आफ्टर 10 days द पेशेंट अगेन कम्स टू यू बिकॉज पेशेंट्स का क्या है, दे फर्स्टली ट्रस्ट द वन फर्स्ट टाइम दे हैव विजिटेड द डॉक्टर. फर्स्ट कंसल्टेशन इज बेस्ट, हमेशा ऐसा ही बोला जाता है. सो व्हेन दे विजिट्स यू अगेन, यू आर लाइक आंटी आपके सिर्फ माइंड में है, यू आर नॉट हैविंग एनी इशू. That's where it's wrong. Okay? Nobody fakes pain. That's the clear-cut thing which we need to understand. Okay? And a patient मजबूरी में ही आएगा डॉक्टर के पास. Nobody wants कि मैं डेंटिस्ट को दिखा के आऊँ, मैं डॉक्टर को दिखा के. So that's the thing. So for the dentist profession and for the other specialties, I believe that if we are not having knowledge about it, any refer the patient to any specialty. See, if a dentist feels that it's related to TM, then definitely you should. The thing is, there are many referral pains. Many times the pain from the neck also refers to head, to the teeth. I have seen certain cases a lot. So you should refer. Yeah, I'm from the same field. I'm not from the another field. I'm not from the different thing. I have done dentistry. I have done oral medicine. And considering oral medicine is a thing where is the first visit of the patient. Okay. OPD department है, patient सबसे पहले आपके पास आता है. So I know the complaints of the patient. I know the patient. जब भी patient अंदर आ रहा होता है तो मुझे पता होता है patient के mind में क्या है. So I'm not telling that I am the only specialist or I'm the special guy who can look into those factors. But I am being trained enough to look into those factors. And a normal dentist or other profession is not. Why the reason? If there is caries, you will definitely go for an endo. But if there is no caries, then why you need to do it?
Exactly.
And if there is no caries, why you need to extract? No doubt the patient is paining on the same aspect. But what if, have you checked all the muscles ever?
We hardly check.
We hardly check. The entire thing lies on the clinical examinations and the skill. So it's like, yeah, at least anyone who should get relief from pain and nobody is knowing that what they are suffering from, they should come to me. At least I will give them a diagnosis and I will try my best to help them out. There are certain times when I also refer patients. If a patient is wanted a surgery of trigeminal neuralgia, I don't do it. I don't do it. I know how I can manage the patient to the best. Right? Even if there is a third molar extraction and I know that that is causing the pain, because certain times it is referred to TMJ, I don't do disinfection. I tried them and I convinced the patient to get extracted to a surgeon or any dentist profession who has referred to me. Uh, I'm not saying that this is a thing like I will get their patients. No, a patient will thank you. If you are referring me a patient, the patient will thank you. Thank you, Dr. Rohan, you referred me. You played a role in getting me diagnosed and getting me treated. And for any next dental treatment, I assure you that he will come to you.
Right.
He won't come to me. And even if he comes to me, I will definitely say, definitely you should visit Dr. Rohan for your dental treatments. And we should treat it as a specialty. Yeah, it is there. Why everybody is trying things. There are certain things I will love to share during the podcast with what Dr. Okesan sir, who is the father of OFP, has shared with me. He always says that treat your patient as he or she is your relative.
We will be more careful for that.
Definitely.
That we should be doing with the patients also.
Definitely. Because patients are giving a huge amount of trust on you. And for the patient aspects, see nowadays, the thing is what happening around, everybody has relatives in the dental field. Okay, everybody has relatives in the dental field. So a patient directly calls you or some another dentist and try to inquire that what should you do. You come, I will see. No, if you are aware, if you are getting aware, yeah, this is not related to you. Definitely, you should suggest them. And the thing is, pain is such a huge thing. We can try the best to give relief to the patient. But for that, we should know that what is causing pain to the patient.
What is the root cause and the etiology is. Because otherwise, if we are giving treatment, then it will come back if the etiology is not treated.
Definitely, that's the fact. Only trigeminal neuralgia is such thing where medicinal management can be done.
Yeah.
And I'm not opposing against it. Okay, I love that when someone doesn't extract the teeth and say it's trigeminal neuralgia, you consult Vijay or you consult Hilmi or you consult any other specialty. And I have seen cases and I am able to do. Now, certain time what happens that most of the time patients come with 17 or 18 files with me. They have visited neurosurgeons, they have visited multiple dentists, they have visited orthopedics, physicians, ENTs and all those things. Certain times ENT is not aware of our field of TMJ and orofacial pain, but dentists are. Yeah. So when you are in one of that pile, when you are in one of that pile, you can at least guide the patient. And nowadays, luckily, I'm getting patients from certain aspects, and dentists are referring, my colleagues are referring, or my seniors are referring to me. I really feel proud about it and really thankful to them because they are doing something for their patient. And Dr. Nildeep sir is referring to patients, Dr. Utsa sir is referring to patients. So that's good. I feel good about it. Yes, there are certain aspects which an oral surgeons or many times oral medicine persons who are not focusing on this aspect can focus. And that's nothing wrong. That's nothing wrong. So we need to be on that aspect so that we can definitely give best to the society. What would be your root thing of being a doctor or a dentist? To provide
treatment and treat the patients.
Provide relief and treat the patient.
Right.
So why not? So this is what me does, and TMD and orofacial pain is associated with it.
That's great. Like knowing this much in depth, it feels like I'm enlightening right now.
Thank you.
And so, as the here are the MDS admissions are coming up.
Yeah.
So, if a person is looking to pursue MDS in oral medicine and radiology, what he or she should look for in a college, and let's come to first the college, and then next question is what are the advancements that are coming in the medicine field, like oral medicine field? Because I've just run a poll yesterday in my Instagram, and so many people are asking me that what are the scopes of OMR. I like to do OMR, but most of the time I'm seeing there is a scope in academics only. But like since you are doing exclusive practicing medicine part, so I would like to know more what are recent advancements is coming and what will be the future of oral medicine.
This was a dilemma since long when I was going for my post-graduation selection process. Academics was, yes, the craze. I joined OMR thinking that I will get a government job and I will be teaching students around and I will be earning a good amount. That's not the case. When everybody calls me, okay, so what is the future of OMR? What do you feel that, what's the scope? What should I do? I say future is in your hand. Scope is in your hand.
Right.
Okay. There are many options you can do. But are you willing to stuck to that option? You need to give time frames. Okay, give yourself 5 years in the same field. Yeah,
Mm.
give yourself. So just discussing things about why after doing OMR, nobody practices OMR.
That's a major question
That's a
because
major-
everyone are doing general dentistry right after that.
If you are not focused on practicing OMR,
Right.
because you haven't selected that branch thinking that in future I will do OMR, I will do specialty practice, then how come you will be taking it as a specialty? I agree to the aspects, earning aspects. Initially, there are no others. Frankly speaking to you, I was getting a good stipend in GDCH. Okay. As soon as I completed GDC, my post graduation, I was not earning the same amount. It's okay. It's okay. It's nothing wrong. But it's up to you. You have to decide. Considering the advances which are coming, see, TMJ and orofacial pain is one of a thing which probably an oral medicine person should look for, okay, or a future oral medicine should look for. We are doing a lot into CBCTs, considering that, see, luckily we have oral medicine and dental radiology and maxillofacial radiology. Outside India, dental radiology is another specialty.
Okay.
In USA, it is another specialty. In Dubai, it is another specialty. So we are at an advantage point. We are getting a degree of both the aspects. Okay, so we are at a higher advantage. They should look for colleges, government colleges best. The reason being number of patients. Okay. Number of patients and variety of patients. See, working in a GDC environment, you get multiple referrals. Okay, referrals means it's a tertiary referral center. The case which is not diagnosed anywhere in the periphery comes to GDC.
Excellent.
So that creates a huge advantage for you. Considering other colleges, what they can focus about, yes, patients are a good thing. Okay, they should focus on patients, but you can also focus on the research aspects. Okay. Just taking an example of TMD in orofacial pain, if you want to pursue certain aspects as an oral medicine, you can research in the college. Out of 100 students, at least 30 are suffering from TMD disorders. I have done study in Karnataka before 2 years. It was my PhD study only which I did in Karnataka. There are students who are suffering from TMJ. They are suffering from headaches. You can work on that. And probably I will also announce certain things which I will be adding in this specialty and in here. That is, if you want to pursue some fellowships or certain things, or if you want to consider a workshops, specifically we will be going through that. Moreover, CBCTs, that's a good thing. Okay, CBCT is an emerging field. Yeah. It has emerged a lot over the 10 years. But you can do a lot. You can provide implant planning reportings. You can do surgical guides. You can do 3D printing. It's up to how you get into those fields. How you take advantage of it. The first point where everybody thinks is oral medicine is a non-clinical approach. So if you start thinking that, you're not going to do it. You are definitely not going to do it. It's a clinical branch. You are dealing with a patient. Okay. You are doing everything. Okay. There was a quote which has been referred to general physicians and all those things. A physician knows everything, but does nothing.
He just refers.
A surgeon does everything, but knows nothing. A gynec knows nothing, doesn't do anything, but takes full the credit. That is what I got to. It's like, it was just on a lighter note. So considering oral medicine person knows anything, and who says you can't do? Who says? During our post-graduation phase, we were the first who started doing TMDs. There are certain incidents which I'll share along. We were doing arthrosynthesis. So arthrosynthesis, everybody like it's a surgery thing. No, it's not. It's not a surgery thing. If you know things, how it has to be done, and if you observe them, you can definitely do that. There's nothing wrong. But you should be confident enough, and at least you should get training around. My first arthrosynthesis, I went to oral surgery department. I saw Dr. Sunal ma'am. I saw Dr. Utsav sir. How they are doing it. Then I did it. I was not like, चलो नहीं नहीं मैं तो कर ही लेता मुझे आता है. It's not the thing. But problem क्या है? मैं क्यों जाऊँ वहाँ पे? You have to communicate with the other department thing. You need to know if you are diagnosed it's ameloblastoma looking at the OPG or looking at the CBCT. You need to know the histology of it. आपने patient refer किया भूल जाओ. That's not the thing. You have seen the patient first, so it's your right. Considering right तो बात की बात आपको खुद के knowledge के लिए तो पता होना चाहिए. So that creates a difference. The scope colleges, see, even many times people are like, sir, ये college में क्या है patient? Firstly, what I feel that prefer a college where there are a number of patients. जहाँ ज़्यादा patients हैं. Even if that college is not teaching you much about it. Because teaching is always to you. Okay. And if you ask me, sir, who is the best teacher? Patients. Patients are your best teachers. My ma'am, Dr. Jignasha, told a quote, Vijay, no two patients will come with a similar complaint of pain. Always remember those things. And that's where the entire pain aspect and orofacial pain comes in. Even two pulpitis patients, irreversible pulpitis, won't give similar complaint or similar intensity of pain. So that's the thing.
And like the OMR field is like every patient is coming to OMR, then it will be referred to anywhere. So you have so much to do. Like if you are doing right with the patient and you are exactly diagnosis the thing, the treatment is half done. It's like a quote that if you are treating, like you are diagnosing the thing, it's half done. Then other portion is just treatment.
You have perfectly quoted this. If you let the patient know what he's suffering from, his 50% of pain is gone. 50% of pain is gone. The patients come here thinking of what I'm suffering from, I'm not getting to know since 4 years, 5 years. I just give them the diagnosis. You're 50% pain free. I said, thank you. Thank you. I remember a case from US. Probably a student from Karnataka only referred him to me. He was not getting diagnosis since 3-4 years. Yeah. I did my best possible to at least give him the diagnosis. And he still is like, thank you, sir, for having given me the diagnosis and what you have done. That's what makes you satisfaction, and that gives you the satisfaction for that.
Right. And like most of the time, there is a pain involved, but for if he or she does not know what is causing the pain, there is a stress factor that aggravates that pain.
Definitely. Right? Just considering you, Rohan, if you are suffering from something, headache or something, right? Or if you are something from anything in the body, so let's resolve headache. So if you are not getting thinking why you are having it, you'll be like, I am a doctor. I can't diagnose me. I am not able to get why I'm suffering from. So just look at the patient situation. Yeah, he's a layman person. And the thing in India and probably everywhere else in the world is a patient in head and neck region, if not getting a diagnosis, he or she thinks he's having cancer. He or she's having cancer. It's the fear factor, yeah.
Lot more bigger fear than like anything else. Like if you are having cancer, like it's ruining your life. But if you are doing, suppose if it's a cancer, but if you're doing it early diagnosis, then you can save the life and you can have a better quality of life.
Definitely. Like, that's the factor, and that's what with the pain also. That's the thing which I'm on. The people should know one thing, that pain is an important thing, yeah. Just keep yourself in the patient's shoes. You will start getting goosebumps if you are keeping yourself in the patient's shoes. I'm listening to a lot of patient's history. I give 1 hour to a patient while examination. So I know when the patient tells, sir, મને જ ખબર છે, મને શું થઈ રહ્યું છે. Nobody's understanding me what I'm suffering from. Everybody is saying, कुछ नहीं है, it's okay, it's okay. That's not the thing.
तो सर आपकी जर्नी अब तक कैसी रही फ्रॉम लाइक हायर सेकेंडरी टू BDS to MDS to like doing exclusive practice in TMD?
Probably it has always been quoted that the road is never the smooth, and it's still going along. I always prefer that कि ये चलता ही रहेगा. That's the part of life. The main thing is you should be enjoying your life. I was not a good student. Recently मैं मेरे स्कूल में कैंप करने गया था. So a teacher from 5th grade told me I really feel proud. I'm seeing you working as a dentist and a super specialist, working as specifically in TMD and this thing. So as ma'am, I told ma'am, sorry ma'am, मैं आपको नहीं recognize कर पा रहा हूँ. She said, it's okay, you are not a bright student at that time. And I told ma'am, sorry, probably I was not that much competent enough at that time. I could recognize. I know, and you are just average student at that time. But during there was I scored good in 10th. I was sure that I want to do medical. I was damn sure about it. Either I wanted to do a cardiologist or a gynecologist. Not regarding the money aspect, but there was a thing. So still, I was not serious about studies. I scored good in maths and science in 10th. in 11th there was an incident. My mom, I always give credit to my mom because she's the source of motivation for me. I was not much serious. We had tuitions and all that. She told me, Vijay, your father is a marketing guy. He is continuing it. Your brother is doing dentistry. What will you be doing? They will be carrying on with their life. What you will be doing? तू क्या करेगा? There are two such incidents where I don't have answers and which have motivated me to do certain aspects of things which I'm doing. I didn't have answer. And that triggered me. That was like, यार अब तो कुछ करना है. So it's a thing. Okay, that was the craze about thing. Okay, yes, I did something and I was studying like hours and all those things and focusing on 12. But you know what I believe and what I want to tell everyone around us. Okay, if you are doing something later on in your life, be happy about that thing. Okay, you are made for doing these things. Just say, for example, if I track back my journey, मैं अगर पीछे देखूं, तो I feel like yes, this was the thing which I wanted to do. How? मतलब how? ऐसा क्यों आया कि मैं क्यों यहाँ पे लैंड हुआ? सबको ऐसा होता है कि यार मैं क्यों यहाँ पे लैंड हुआ? But give time. At 5 to 10 years आपको पता चल जाएगा कि आपको यही करना था लाइफ में. 12th, I remember incidents के physics में पढ़ गया. Considering कि हमें MBBS में क्यों नहीं मिला, just an exam, कि हम शायद 0.5 या 0.6 मार्क्स का डिफरेंस था, 0.5 और 0.6 था, nothing that. Because हमारे टाइम पे गुड साइड 40% था और 60% ये था नॉर्मल बोर्ड्स का. So there was a physics paper. I got 92 in physics. Two marks questions which I didn't know. I wrote something in it, but I was sure I wouldn't be getting good marks in it. So there were 4, so 96 I think. One MCQ, I was sure it was wrong. Right? So there was 95. So I calculated and I was like, I will get 95 out of it, out of 100. I was sure about it. After I came home, I realized I missed 3 marks, numerical, which I know. And that, at that time, you are sure that this I know. There were 3 mark numerical. So I was not having answers that why I skipped it. It happened. I said it's okay. I wanted to do MBBS. I was getting in Karamsad. We are not able to afford it. I thought we will get, if I get in CUSHA, I will do because CUSHA fees was less. I couldn't. But I somehow got into last seat in GDC Jamnagar. My brother told me, don't go for much of a expensive, okay? Go for dentistry because my brother was doing masters in oral medicine and dentistry. So he was like, go for it. So I got a last seat in GDC Jamnagar. Then there was a thing which Karamsad came up. If people are not affordable enough, they will be getting 10 free medical seats. They will be doing all the expenses on that and they will be paying for the fees, but we have to serve them for a certain period. I applied for that. I was 13.
They are taking 10 and you are...
I was like, that is okay. But those 10 from GDC gone there, and luckily I got into the GDC. So I reshuffled from GDC Jamnagar to GDC Ahmedabad. So that was good for me, and my parents were happy. At least because my brother was living outside, and they were good. Yes, at least I am staying here. So that was the way. And even the entire thing, I can track the incidents that where it happened, and I landed into this. There was a physiology viva in the practicals. I was damn good at physiology. And even the sir, Dr. Sharma said, who was teaching in Karnataka, he did, Vijay, you will score good. So he was not the examiner at that time. There was some senior lady who was probably working in GME or something, I don't remember. She came, she asked me, and her reaction was not good. I don't know why. I answered her pretty well, and Dr. Sharma knew that thing. So I just met him after that. Yes, मुझे पता है कि तुझे ऐसा face किया, because at the Viva voice there was another lady. She asked me and I answered really well. She was like, तेरा practical अच्छा नहीं क्या? नहीं मैम, practical तो बहुत अच्छा गया. Hemoglobin measurement, that's the easiest thing. नहीं मैम, that was good. She asked me twice. So doubt तो आएगा कैसा क्यों हुआ? मैंने 12 के सर को पूछा तो सर ने बोला कि कोई नहीं, तू रहने दे, वाला नहीं. After the result came, I scored less in physiology as compared to most of them. Again, it was a thing for me. Sir told कि मुझे पता है कि ऐसा हुआ तेरे साथ नहीं होना चाहिए था, but somehow ऐसा था कि you are passed, so I did much. So ऐसे बहुत सारे incidents हैं which over the duration happen, I was about to get oral surgery in MDS. So, that's a long story. Probably we'll discuss something someday. So I believe and I feel that you will land where you are to land. Just have patience, yeah. Just have patience.
Shifting to the next part, what advice would you give to a BDS student who is just starting with their clinical rotations? Like they have just started doing their patients or seeing their patient doing their diagnosis from the third year or final year. What advice would you give to them?
Best and the first advice is listen to the patient. The patient will give you the diagnosis. This is the quote which is we are hearing everywhere along. Right. But what we do is when you're in third year, you see final year or the intern seeing the patient. So what happens at the intern stage? Everybody is like, ठीक है ये लिख दो. But that's not the thing you need to do. The interns are not realizing that the third year is learning from you. थर्ड ईयर इज लाइक वो जो देख रहा है वो सीख रहा है. वो खुद का कब डेवलप करेगा, वो खुद का कुछ क्वेश्चन कब पूछेगा. सो फॉर थर्ड ईयर आई विल डेफिनेटली से के ट्रस्ट योरसेल्फ व्हाट यू आर टॉट in your clinics or in your lectures. Try to focus then and ask the patient. Ask the patient. अब प्रॉब्लम की बताऊँ और ज़्यादा कहाँ हो रहा है कॉलेज फील्ड में. सबकी पोस्टिंग ओरल मेडिसिन से स्टार्ट नहीं होती. That's the disadvantage.
Definitely, if someone is starting with prostor or something like that, then the major diagnosis portion is left behind.
And ऐसा नहीं है कि I'm telling other fields like they can't diagnose, they can, but उनका focus उसी aspect पे रहेगा यार. If a endo postgraduate is seeing OPD in endo department, he won't be concerned about anything else.
Right. He just want to see the tooth because I guess they are having like 200, 400 OPDs for the tooth pain and that is related to endo. So just general they will miss out anything else other than the root cause that is endodontical.
Definitely. And what's happening in most of the time, there are certain lesions which are missed out here. ठीक है. Because लिख के आया या पता नहीं देखा है डायरेक्टली आपने 6 में पेन है, ठीक है, तो यार म्यूकोसा तो देखेंगे ही नहीं. सो जो थर्ड ईयर जो ऑब्जर्वेशन में है एंडो डिपार्टमेंट के ओपीडी में है, उसका तो फोकस जाएगा ही नहीं. आई एम नॉट श्योर समहाउ हाउ वी कैन डू दोस थिंग्स के हर एक को ओरल मेडिसिन का एक्सपोजर दो यार, एटलीस्ट फॉर वन डे. साथ में वन डे तो एटलीस्ट दे नो के बेसिक क्या चेक करना है, बिकॉज बेसिक वो हिस्ट्री में आ ही नहीं रहा है, पता ही नहीं है. नोबडी इज आस्किंग अबाउट how you greet a patient when a patient comes.
કેમ છો, શું તકલીફ છે તમને? Basically start with the name of the patient so it builds a good rapport, but we start with hi, hello, and start with the history, like what is the chief complaint of patient.
Just consider the thing if you are a patient and you are visiting any college or you are visiting any dentist, like, hi Ron, how are you doing?
Being monotonous.
I'm good. So Ron, open your mouth. Ron, what's your complaint? And mirror probe is inside, and the things are asked like this. Ron, so takleef hai? You won't be giving answers.
Right. Yeah. Most of them like I was શું છે. So like I will start stuttering for that moment.
Definitely. And that's creating fear, yaar. That's creating fear. Yeah, that's creating fear to visit you. Yeah. And what is happening whenever a dentist or a young graduate, third year of either, sees a child, they treat them in a nice way. That's a good thing. But why not the same adult patient? Why not the same adult patient? I have seen. I'm not telling name also to the patient. You know the name, yeah. The patient is cupping with a case paper in your hand. You can read the case paper and you can ask him, hi Ron, how was your day today? How was your journey to this hospital? I hope you are traveling around 10-15 kilometers. Was it smooth? Did the rain bother you a bit? I can feel the weather is around a bit off nowadays.
Start building with the rapport rather than going for the chief complaint first to make it comfortable for the patient to speak more.
It has to be. It has to be. And you need to get to know from the expression of the patient that what is this going in his mind. Certain time when you ask about diabetes and hypertension, patients are like they are hiding. If they are hiding, then you have the way. Okay. બસ સાચે કઈ નથી લઈ રહ્યા. બા તમે બીજી કોઈ દવાઓ લઈ રહ્યા છો તમને યાદ હોય તો? રોજ લેવી પડે એવી કોઈ દવા છે? Oral surgeons use this. I'm not sure much of a surgeon, but I have seen Dr. Utsa sir, and he's like a great mentor to me. He always says કે you ask about a thing કે બા કોઈક એવી દવા છે જે તમે રોજ લઈ રહ્યા છો? ક્યાં એક રાત્રે નાની ગોળી 10 10:30 લઉં છું, ડોક્ટરે કીધું. બસ શેના માટે કીધું છે? હા, એ કે થોડાક ટાઈમ પહેલા મને છાતીમાં દુખાવો હતો ને એટલે સાહેબે કીધું કે આ લોહી પાતળા કરવાની છે તમે. It's not about કે the patient is trying to hide those things, but it's about the way. It's about the way. I'm not sure, but if you are also a fan of House MD, he always quotes that a patient lies. But what I feel in India is the patient hides. That's true. Okay? The patient hides. But it's your role. Okay? It's your role to get maximum information out from the patient. Okay? And that you can do. But if you want to, if you want, if you don't want, if you are just focused on the teeth aspect, and it's always the thing, if you are an old medicine or if you are a dentist, okay, look at the body. Okay, look at the body. The patient will appreciate you. If you see swellings on the leg, ask the patient about hypertension. Ask the patient about kidney disorders. Ask the patient about thyroid. And if it is diagnosed by your side, just by looking at this aspect, patient will like saluting you. So for a graduate, but for a third year or final year, it's like, yeah, focus on the broader aspect. Just don't focus, you want to clear exam. That won't help. Okay. And the most important thing, which I was thinking just when I was trying one out, patience. Patience is the most important thing. That will give you the best diagnosis or the best way to reach and approach the patient mind. That will give you the best outputs. Don't focus on easier and faster ways to earn money. Okay. Everything will come. It will take a bit of time.
Just when you said that if your diagnosis other thing and patient is like saluting you, it gives me goosebumps. And like it was happening, like it didn't happen with me, but like my colleague, the patient, he took the history in the exam. A patient gave no medical relevant history, but when the examiner came and asked, patient starts speaking everything. So that time I feel that the asking method is a little bit off, like for in the learning phase in third year final year bit. And like if I say like my first patient is a third year, and I directly posted it to OMR. And I just took the mouth mirror and ran across the teeth on the upper arch. Then I put the mouth mirror. I don't know what I have seen. I am totally blank what to write on the paper, because at the time like no seniors are there as well, because final year exams are ongoing at that time. So but slowly I was seeing the seniors what they are doing, and especially when they are calling for the staff, what staff is seeing, how they are seeing, how they are holding the mouth mirror.
Yes.
With starting like what happens, like all of our colleagues are meant to sit on the chair and we diagnose each other. So the way I hold the mouth mirror and start stretching the cheek, and I'm impinging mouth mirror on the gingiva. So it is painful for that, but I'm not sure what I'm doing wrong. Then I see you, I see Nildeep sir, I see Mukesh sir, how they are doing it. They are like miles away. They're like running across to the chair and like they're doing इसको ये तकलीफ है, इसके इस बारे में पूछ ले. So how they are doing this from that much distance. So like it's a really good thing. Look at the patient, how they like in the PCD we have also noted down the gait and the weight, height, if there is abnormality in walking also. So so many concerns are there, and we can diagnose something that a patient is more get help from.
These are, they are rightly said as this thing. See what I believe again. One of the points which I read to it is observation. You need to keep your eyes open. You have to have that observation aspect. Third year final year are distracted. Sorry to say that. I'm sorry. Don't mind others. They are distracted. That's not the thing you do. Dentistry or medical field. A dentist or a doctor should not be distracted while viewing a patient. Your personal life is different. When you're seeing a patient, you're having thoughts of your family at the back. That is not helping you. That is not helping the patient and not helping you. There are certain incidents. There was a a junior of mine. I was in postgraduate in JDCS. Okay? I was just writing certain things on that. A patient came. He sat on the chair behind me. Intern rose up, a junior of mine. He checked the patient. He said, "Vijay bhai, કંઈ લાગતું નથી મને." I said, "એને કેન્સર છે." I haven't seen a patient. Sorry, I'm just being a bit of like, એને કેન્સર છે, તું ધ્યાનથી જોવો એને છે. બીજું મેં ચેક કર્યું નથી. મેં કીધું એની જોડે GCRI ની ફાઇલ છે. I haven't seen the patient. મેં કીધું એની જોડે GCRI ની ફાઇલ છે, તું જો. કે વિજય ભાઈ નથી. કીધું તમે ક્યાંક બતાવ્યું છે? કે હા બતાવ્યું છે. તું ક્યાં બતાવ્યું છે? કે આ કેન્સર હોસ્પિટલમાં. મેં કીધું કેમ બતાવું? કે મને ચાંદુ છે. કે ક્યાં છે એમ? એકદમ ડેપ્થ ઓફ ધ વેસ્ટિબ્યુલ ઓન ધ લેફ્ટ સાઇડ, લોઅર ડેપ્થ ઓફ ધ વેસ્ટિબ્યુલ છે. તો ત્યાંથી શું કીધું કે તમે પહેલા ડેન્ટલ કોલેજમાં જઈને બતાવી આવો, ત્યાંથી શું કહે છે પછી આપણે આગળ કરશું. So more of the time it's just an observation. Okay. You need to know that what the patient is having. Patient શું records લઈને આવ્યું છે and how it comes. It comes after practice. I'm not saying that I am like a guy કે મેં પહેલું જ patient જોયું. It's like no, it comes after practice. But if you are sticking at your basics now, it comes from the first patient. It's not like that બહુ જ experience here. It comes from the first patient. If you are doing all the things right, all the things right, and even if I know now, most of the times when I'm discussing with patients on phone also certain times, who are just calling for, I need to talk to a doctor for them, right? I know that what the patient is suffering from. But when the patient comes here, I start from the first question. I know, so I don't directly jump to those things. Because what will happen around, if I'm jumping to those things, I will miss many aspects. So have patience. Observation is the key. Okay, be observant enough and stick to your instincts. Many times there is an instinct. Okay? You know that this might be the diagnosis or this might be the thing. Stay to it and tell it. Don't be fearful. Tell it. But there is a way of telling. Okay? That matters. If you are in a discussion ground now, you should also know a certain knowledge about the disease which you are telling. Really, if you don't mind, I would like to share an incident of my post-graduation. Well, it was first month of my post-graduation in GDCS in oral medicine panel. Being the guy from GDC only, I was knowing what are the cases and all those things. So I was discussing with the seniors, with the third year and the second year postgraduates, what do you think the diagnosis will be in this case? So everybody was telling it's an abscess or something. There was a swelling on the palate. And everybody was like, it's an abscess or something. And we should like somehow the sir called me. I wouldn't blame or I'm not saying anything about it, but it's like, તને શું લાગે છે? What do you think it is? I asked the patient to sit in the chair. I took the gloves. બધું જ પૂછ્યું history. Because I am like, હું એમને ના કહું. I need to see. મેં સારી રીતે જોયું હોય તો ચેક કર્યું, પાલ્પેટ કર્યું, બધું કીધું. હિસ્ટ્રી લીધી. પેશન્ટનું teeth સારું. teethમાં કોઈ એમનો નથી. I told her it's pleomorphic adenoma on the palate. They're like, huh? They were kind of a bit laughing in it. देखो ये pleomorphic बोल रहा है. देखा है तुमने कोई केस pleomorphic? बाकी बड़ी कब सब. But there was a good thing about it. तने केम लागे छे? He asked me this thing, which I really liked. He was on that. You have thought तो तने केम लागे छे? You sir, swelling जे छे, must covered छे palatal mucosa. It's kind of form, soft નથી. Abscess હોત તો soft હોત. Form છે. Teeth માં કઈ નથી. તો કેમ pleomorphic? તને કેમ સીધું લાગે? Sir, it's the second most common site. After parotid, palate is the second most common site. So they kind of take in a laugh or something. After 2 months, the histology of the patient. It was pleomorphic. I didn't tell anything on that aspect, but that was the thing. So it's like trust your instincts, yeah. And you should be having a base of what you are saying. See, even if someone comes to me, even if you come to a discussion, I always ask, why? Why you think it is like that? So you can come to know, okay, what's your thinking pattern? Okay, and does it match with the patient's diagnosis or not? Does it going in that way or not? So these are the things which you need to focus a bit.
And I was about to ask you that if you can share some of the interesting cases that you have done in your PG life or in the recent times.
This was one of the interesting. In the recent times, there are certain cases. During the post-graduation phases, there were many cases specifically focusing on TMJ aspects. Everybody was like, it's not related to TMJ. When we started as a post-graduation, what everybody in the college used to say is, okay, oral medicine is a department which is just working as a traffic control. And even a doctor told like, okay, you're just directing the patients to this. When I came, I wanted to do oral surgery, frankly speaking. There were two branches which I wanted to do, oral surgery or oral medicine. Okay? Either you do everything or you know everything and you have the potentiality and capability to do everything, but it's up to you whether you do it or not. Okay? So this is why I loved oral. So we were, yeah, ऐसा तो नहीं होगा. So initially, most of the patients we were diagnosing as MPDS. एक दो महीने चला. I was like, उसके अलावा कोई डायग्नोसिस ही नहीं है. MPDS के अलावा कोई डायग्नोसिस ही नहीं है. And somehow my senior Dr. Bhavik, I came and he told me that there are many things which we can do about it. I really appreciate him, and he's the reason probably why I am doing an orofacial pain specialty. So we just focus on other aspects. We try to look into TMJ disorders, specifically affecting disc and all those things. So there was a case I remember, a 19-year-old girl. She came from probably Jamnagar or something, and my colleague has seen her. So we were just going to ma'am to tell that what. So my colleague told it's an NPDS. Ma'am asked me, what do you think? Ma'am, I feel it's a case of anterior disc displacement without reduction involving right temporomandibular joint with secondary osteoarthritic changes. Like, what the hell is telling? What the hell is telling? So I was like, ma'am, the patient's mouth opening is reduced. The patient's mandible is deviating towards the right side. The patient is unable to take his jaw to the left side. On radiographic, there are bony changes. So ma'am, as per Wilkes classification, it's positive disc category. Like, how come you are sure about it? Okay, ma'am, I'm just standing on the clinical basis. That's a differential diagnosis I will give. We need to confirm with the MRI. And probably the patient was having MRI. So I kept this as a diagnosis. So like, okay, that's okay. So there are certain things, and there are lots of certain cases which we have gone through. The incident why I focus on OFP was we were seeing amyloblastoma, tumors, and all those things. A lot of cases of that. So exactly at 1.5 years, my first year was complete and my second was just started. My senior Dr. Bhavik. He's a great guy, and I always thank him whenever I'm doing any presentations or whenever I'm doing anything. He and Dr. Occasion and for he told Vijay, क्या બધું તો ઠીક છે તો ટ્યુમર જો છે સિસ્ટ જો છે કે what about chronic pain કે એના માટે તું શું કરી શકે. Again I was speechless. This was the second incident where I was speechless. આવું તો નહીં ચાલે. We want to do something about chronic pain, and then I somehow started about pain. I learned a lot about pain. I learned from Dr. Occasion's book about TMJ and his book of orofacial pain. I used to ask about anxiety. I used to talk about stress. I did a bit of counseling also to patients on that aspects where I could and where I was able to. And I was like, what he's doing, he's talking to patients for 1.5 hour. Why? And I used to call the patients after OPD hours, during my lunch breaks or second time, because it was a thing that everybody was like, what he's talking. And for us, counseling is a thing which has to be done on a personal aspect. I remember everybody talking about like, what the hell he's doing with the patient for 1.5 hour? We are not understanding those things. But it was a thing, and my ma'am always supported. And every aspect, she was like, if you know how you are able to do it, do it. But you should. First, after synthesis, we went with the ma'am. She was like, okay, how will you do it? Like this. So like, okay. She was just like, okay, dude. She supported on every aspect. Probably on the second or third month, we started with OSMF intralesional injections. In my seniors, haven't started that. And then the second month, I was doing biopsies. Okay. I was like, I wanted to do it because there was a surgeon thing inside me. Yeah, I need to do. We were doing a lot of extractions also in department. Not obvious one, but those who were causing ulcers or those things. We have did cyst enucleations. I hope my surgeon friend doesn't tells me that because that's why we are not able to do so much surgery. There was a Kadi, a prisoner. He had a lip swelling. So my junior told me कि सर इसको lip swelling है. सर आपने करे क्या? बोला diagnostic aspect. सर आप देखो ना क्या लगा. So we are like, that was a rare case. It was a pleomorphic adenoma of lip, upper lip. So she was like, सर हम करें. ठीक है चलो देखते हैं. Lip is not that much dangerous or something strong. So we had all the investigations done and everything. And we removed that entire approximately 3 or 4 centimeter of diameter of lesion. So these are the things which we have given blocks. I was like, I have given glossopharyngeal block in a college. See, things comes, होता है चीजें बराबर, कुछ ना कुछ होता है, complication होगा, but you should be knowing कि क्या हो सकता है, and you should be able to explain that thing to the patient beforehand and take concerns. Considering if you are in college, you have backup of oral surgery. That's always great, and sir always helps. And sir and everybody in the department helps. You can do this. What was the proud moment was Dr. Utsa sir. When I was in third year, the patient directly visited him because he is also getting a lot of references from that college. He saw the case and he just said, "So Vijay first this case. Let's see what he is telling on this." Probably you get that is the moment when feel where a sir says that let Vijay say okay, yeah, guys. There are certain things, and I really always thank him for always motivating me. Whenever we are working a lot on certain cases. When I'm telling certain things, he's like, "You are doing good. Keep doing this." So always. Similar, there was an incident here only which I saw a case of mucormycosis. The patient visited Bangalore or something. He was told that you are having something in your lower left 8, and he got extracted there, but still the patient didn't get any relief. He was admitted in a hospital in Bhopal. He was checked there also, but there is nothing. Patient came to me. It was mucormycosis of palate, and that palate was affected. The patient was not aware of those things. We took a biopsy and we operated the case together, me and sir. And that was the thing. The patient was also helpful to me, thanking to me because I thank you because of you I'm getting a diagnosis. Probably now I will be treated for this.
That's great. Like for that matter, like if you can give advice to BDS people who are doing BDS, not BDS, like let's see about MDS, who is doing MDS in oral medicine radiology. What advice would you like to give to them?
Be curious. Okay, always be curious. You will learn everything new. You learn every day something new. If you keep your eyes open, if you keep your ears, that's the basic. If you are not able to keep those things, nobody is going to help you. And always believe that you are the only person who will be helping you. Try to be open, yeah. Try to ask for things. Okay, do certain courses if you are feeling so. Try to learn. We also think that why I'm going to US for this orofacial pain and everything. I'm doing a lot of things. No, I wanted to. I wanted to see what extra they are doing. Okay, what extra they are adding to the table. And the most important thing which I am doing and which I learned from there was accept your mistakes. I have accepted that. And I have accepted openly about things. There was an incident. I was an intern and upper right 6 I extracted. And there was a piece in the palatal aspect. So there is a rule. You need to be cautious while you are doing those things. Somehow mistakenly got pushed into the science. Accepted. Yes, I did it. It was my mistake. Initially, 1 to 2 years, I was like, okay, I done something wrong. Yes, you have done wrong, but at least the patient didn't suffer much. Sir, remove the root piece. Okay, through the probably sinus approach, he did an buccal advancement platforms, and it was closed. The patient is doing good. I followed that patient for 2 months. Okay. The patient was having acid in the another tooth in the endo department. I went with that patient. I get the acid. I'm not saying that I did something wrong, so it was not wrong. It happens. It happens by everybody. Accept it. If I'm in ignorant, then it's a new ask. I don't know how. Something like that. So always try to accept those things if they are happening around. Okay. So you will be doing a lot of those.
That's great. And so let's end our conversation with, as you have done so many patients, you have heard so many myths as well. So what are those myths, and how to, if you can solve few of the myths for a layman, and for if as a dentist or a dental professional, I want to explain to a patient if he is telling me that no, this is this and I heard like this. So
I will be coming to that aspect, but before that, I want to just add one thing.
sure,
What do you feel about snoring? Is snoring good or not?
definitely not. Because I feel like it is because the tongue or something is blocking the pathway and it is reducing whatever the oxygen carrying capacity and something like that, but it's not a good thing.
What everybody feels around.
It's a normal thing, natural. The snoring is natural.
Most of the time, we have if a person snores, he's having good sleep. He or she.
Right.
That's absolutely wrong. That's absolutely wrong. And probably in India, and we are not much focused on it. But recently, from the US trip, I learned a lot on snoring and sleep apnea, and I am working on that. Okay, obstructive sleep apnea is a thing, okay, which is the cause of your blood pressure, which is the cause of your diabetes, which is the cause of your headaches, which is the cause of bruxism, and which is the cause of your kidney disorders. It's proven. There was a neurologist taking a lecture. He said it's proven. Firstly, for layman people and even for dentists around who are not knowing, okay, snoring is not good. Okay. I'm coming with a sleep device which is more advanced nowadays, with not those much factors on the face, and it's an easy go. And I'm started doing sleep studies. I'm doing devices on mandibular advancement so that people can sleep peacefully. Okay. And what you know exactly is what you don't know is snoring affects the person who is sleeping with them.
It disturbs their sleep too.
Yes. In US, that's a huge concern. In India, it's not. In US, it's a huge concern. The lady is like, my husband keeps snoring, I'm unable to sleep. And here, ના એ તો સારું ઊંઘે છે ને થાક્યા હશે એટલે ના હોય, it's not like that.
Sometimes it's like a competition. She snores more.
Yeah, so they are sleeping well enough. That's not the case. So, so that's the thing. So if you are having any patient or if you are taking just a history of snoring, ask them to get a sleep study done with us. Okay. So at least we will be able to help the patient in a lot of aspects, in much more aspects, which probably nobody thinks of. The other myth is what a patient has is કે મેં દાંત કઢાયો ને એના પછી આ બધું થઈ ગયું, એટલે કેન્સર થઈ ગયું કે જે બી થઈ ગયું. That's not the case. Already, as you are in the same field, you also know that whenever there is a carcinoma in the maxilla or mandible, the tooth becomes mobile because due to bone destruction. So what we do as a dentist at a certain time, we go for extractions. That's the point where you should not. Okay. Because patients have developed those things. લોકોએ દાંત કઢાય છે ને પછી જ કેન્સર જાય છે. Because patient ને શું complaint દેખાય છે? દાંત હલે છે. Patient is not seeing કે અહીંયા ચાલુ છે. પણ તમને તો દેખાય છે. So that's not a myth. Okay. After extraction, cancer spreads. Okay. So you need to remember કે this is a myth કે દાંત કઢાય પછી કેન્સર ફેલ્યું. કેન્સર પહેલાથી જ હતું. કેન્સર પહેલાથી જ હતું. પણ દાંત કાઢ્યો એટલે વધારે એગ્રીવેટ. સો તમારે એ કેવું છે, તમારે એ કેવું પડે પેશન્ટને, ઓકે, કે તમારે નીચે ચાંદુ છે, પહેલા તમે સીટી સ્કેન કરાવો તો પહેલા તમે બાયોપ્સી કરાવો, પહેલા ટ્રીટમેન્ટ પછી લાગે તો સર્જન કાઢવું કાઢશે, ઉनको સર્જન કોઈ વાંધો નથી. બીજું મેં એવું છે કે અપર થર્ડ મોલર કાઢો તો આંખમાં પ્રોબ્લેમ થાય. આ કેવી રીતે ડેવલપ થયું હશે હું તને કહું ફ્રેન્કલી. હજી બી જે પેઇન રિલેટેડ જે કેન્સરના ફિયર્સ છે કેવી રીતે થયું હશે કે મોસ્ટ ઓફ ધ ટાઈમ ડાયાબિટીસ પહેલા બહુ ડાયગ્નોઝ નહોતું થતું. પેશન્ટને સિવિયર ડાયાબિટીસ હશે, એક્સટ્રેક્ટ કર્યું હશે, હિલિંગ નહીં થયું હોય, પેશન્ટને ધ્યાન નહીં આપ્યું હોય, સ્વેલિંગ આંખ સુધી પહોંચ્યું હશે, પણ હવે એવું નથી. So at least we need to be sure about the investigation aspects, about the history aspects. So you can explain the patient in that way. પહેલા આવું થયું હશે, હું ના નથી પાડતો, પણ એવું સાચું નથી. દરેક પેશન્ટ એવું નથી થતું. તમે સાચું ક્યારે માનું?
હમ.
10માંથી 6-7 પેશન્ટ આવું થયો તો
Right.
એક બે પણ આ તો કેવું છે કે અફવાઓ ફેલાય એવી રીતે એક એવી વસ્તુ છે કે કોઈક વાત કરી આસપાસ તો એવી છે કે ઘણા પેશન્ટ મારી જોડે આવે છે કે સર મને તો આવું કીધું કે તને આવું હોઈ શકે. મેં કીધું એ તમને ટ્રીટ કરી શકે છે? એની જોડે એટલું નોલેજ છે, એ આટલું ભણ્યું છે. ઘણી વાર TMJ હોય ને પેશન્ટ કે સર દાંતમાં દુખે છે તો આનું ને આનું શું લેવા દેવું? એને પૂછો, એને ખબર હોય તો. It happens. There are different pains here. So you need to guide the patient in that aspect. Take him or her in that confidence. Be polite with the patient. Be polite. That cures most of the disease.
And like I really do agree with that. Like patient is already in pain. He's already irritated. If you are bossing around, showing your ego, and rather than that, if you are being polite, he'll more appreciate what you are doing. Even though if you are not able to diagnose this thing and you are going to anyway refer the patient to someone else, but if you are polite to the patient, that's make a lot of difference.
He or she will definitely remember it. She will definitely remember. There was recently a case, the patient was in severe pain. He got consulted with me for first sitting. I know the diagnosis. I tried to relieve his pain. The patient was still in severe pain. I asked the patient to refer to get visit a neurophysician for the same. There's nothing wrong here. There's nothing wrong. Yes, it required guts. It required guts. But if that patient gets treated and gets cured, he or she will definitely refer you another patient.
Definitely.
Even if you have referred them to another doctor. When you have referred them to me. And what I do is I always ask the patient to visit the dentist back and thank them. It was them who have referred me to me. Right? That's why you are getting treated. So always be thankful. And this attitude you should develop in yourself also. Always be thankful. There's nothing wrong.
So thank you so much for having this amazing conversation. I hope the listeners have learned so much from this, and definitely like the observation part. I just learned that if you are like the patient is coming to the, and if you haven't seen the patient, but you have seen the file of GCRI. I have been through GCRI, like I have posted for 1.5 months, but I didn't that much observant. But now I'll be observant for anything that what records he is coming with or he or she is coming with. So definitely it's a takeaway message for me also. And thank you so much. And I wish Healme grows a lot more. A lot of people like you doing exclusive practice for the TMD and lot come to India and like doing a lot more for the patients. And definitely the pain, chronic pain is more irritation rather than the acute pain, and the sleep disorders are like being more awareness is spreading right now, so it will be much better to have such person like you in our podcast.
I hope yes, this goes a long way along. Okay, and I'm trying to educate people around. I'm just sharing that we are coming with a website. It's healmepainclinic.com. There we will be having certain aspects of workshops also and training also. And I am free to teach people. Okay, if you want something, mail me, WhatsApp me, Insta me. Okay, get a message from the website. Okay, sir, I want to learn this. Are you conducting courses? Do you wish to teach us? Definitely, I will.
Definitely, and I'll post all this link of yours to a description of whatever platform it is being streaming on right now.
So that's the thing. The best thing is keep doing. Okay, you will get paid off sooner or later.
Right.
Sooner or later, you will get things paid off. But at first, try to do things. Okay, you should be trying. Okay, it's not just a you are like just doing on this, and I won't do this thing. I won't do this. That's the original medicine you need to do. Okay? You need to be aware of CT scans. You need to be aware of MRIs. Don't just stick to CBCT. Yeah, you are a radiologist of head and neck. You are a maxillofacial radiologist. Okay. So that's the thing. You need to understand the term. It's a maxillofacial radiologist. Okay. So you need to know how CT scans work. Look at the CT scans. Yeah. Many times I was proud when a oral surgeon PG refers to me कि मुझे बताना CT में fracture कहाँ दिख रहा है. You have got that potentiality. Yeah.
Right.
And I was to Gurgaon for Noida for a course. They asked me to teach the postgraduates and the students about reading CT and MRIs in head and neck. feels good. Yeah, keep supporting people of the same field, and even from the other field.
Definitely.
That is what lacking in the dental field, which I believe. Sorry to say that I really don't feel good while I'm saying this thing. Keep supporting people and keep supporting younger dentists. That's about it.
Right, and earlier, I want to add it's a time for exploration. If you are not earning much, but then start exploring something.
Yes.
You will get to the point where you will be paid off nicely. But till then, explore. If you're younger, you have more potential to explore, and the field of OMR is a lot broad. Like it's ocean. Like you can do anything.
Anything.
Compared to other clinical branches, they have their broad seas as well. But here you are like treating a general patients as well. So there is a lot more in it, and that's definitely a good thing.
The main advantage is, as you told, it's like an ocean. Yes, okay, you try to explore things, you will learn a lot. There are certain times you will feel like, "Hey, what the hell I'm doing in my life?" It will happen, but everything will find its way. Okay, and the best thing, the best advice which I would like to give to everyone around, every dental student around us, get updated with the technology, but don't forget your basics. Don't forget your basics. Okay, if you don't know the basics, you won't do anything with the technology. Okay? It's not like you can't jump the steps. You can't jump the ladders and all. There is a step, and you need to take those steps.
Definitely. So it's like you are telling patient to do CBCT, but that work can be done through RVG as well.
Definitely.
So basic is more
More
important.
important. And you need to know what you're looking for. Yeah? If you're not having a clinical diagnosis and you're just asking the patient to get investigated, that doesn't work. Right? That doesn't work. If I'm writing an MRI, I know the reason why I'm writing the MRI. Right? If I don't know the reason,
what is the meaning of giving extra investigations? It hinders the patients financially,
mentally, every aspect. Okay. So it was really great one for having me here. I'm really proud that you are doing a lot in the Unidontia field, and I would love to be associated with you for longer terms. Whenever you feel free to call me, you can.
Definitely, sir. It's all my pleasure to have a great conversation with you.
Thank you so much, man. Thank you. All the best to everyone. Okay. I hope you do a lot of things in your life and you achieve whatever is written for you. Okay. Because many times it's not good what you want. Yeah? There is something written better for you. Okay.
Definitely.
So always believe that aspect. Okay. Thank you.
Thank you so much, Vijay sir.
Okay.
Thank you for watching till the end. Hope you have got some value from this episode. We have placed all the necessary links in the description. And if you want your questions to be asked in our upcoming podcast, there is a form in the description and on our website. So do check it out and give us a like and subscribe to our channel to support our work. Thank you so much.